Thank you so much for the kind introduction. Good evening, ladies and gentlemen. The President of the College of Community Physicians, Dr. Jayaratne, the President, Commonwealth Medical Association, Professor Jayalal, the Minister of Science and Technology, Professor Abe Sena, Vice Chancellor, University of Colombo, Professor Karuna Tilake, the Dean, Faculty of Medicine, Professor Disanayaka, and Honorable Chief Justice, Mrs. Fernando, and all distinguished guests invited today. I'm very grateful indeed to the organizers of the Global Public Health Summit for inviting me to join the distinguished list of speakers who have contributed to this summit. It's a great privilege and honor to be here. Sri Lanka stands out as a great exemplar in the region and globally of what can be achieved through scaled public health efforts, offering us a story of success in accelerating improvements in child survival. This offers hope to other countries in the region and beyond of what can be achieved when you have commitment, unwavering resolve to improve the well-being of each and every citizen of a country. The College of Community Physicians is a key part of that story. My talk today goes right to the heart of the broader goals of the Global Public Health Summit, exploring innovative, evidence-based solutions that ensure equitable and accessible health care for all. I'm going to explore these solutions through the lens of delivery of maternal and child nutrition services. And I'm going to argue on the need to narrow opportunity gaps and inequities in the delivery of maternal and child nutrition services. I'll make an argument in three parts. First, South Asia's insufficient progress in resolving child malnutrition is affecting the survival, growth, and development of children and continues to hamper the region's attempts to accelerate human capital formation. Child stunting, wasting, and hidden hunger pose serious threats to human capital formation and the economic development of nations. Second, systems are failing children, and in many countries in South Asia, the delivery challenge is a constraint to progress on nutrition. And nutrition services are not universally delivered or accessible to all. There are inequities in the delivery, and some children and their families and communities are being left behind. Third, I'm going to suggest some ideas on the kind of change that we need to be debating if this tide is to be reversed. The remedies need to go well beyond the confines of just the health system, because across South Asia, children, women are all affected by all forms of malnutrition. In addition to undernutrition, overweight, obesity is becoming a big challenge and a big risk factor for attainment of good health. And we need, in equal measure, to also deal and address the commercial determinants around this increase in overweight and obesity. So South Asia continues to have high prevalence in numbers of wasted and stunted children of any region in the world. When looking at the challenge and context around nutrition, girls and women are undernourished and overlooked. And this is mostly driven by lack of access to nutritious foods, inadequate access and utilization of nutrition services, and then third, harmful social norms and practices. 1 in 2 girls and women within the region suffers from anemia. 1 in 10 suffers from underweight. And this is contributing also to poor birth outcomes. So at the heart of the nutrition challenge within South Asia is the high prevalence and burden of infants who are born low birth weight. 1 in 4 infants is born low birth weight within the region. And this is a key driver contributing to the high prevalence of child stunting, child wasting that we see within South Asia. And 1/3 of all stunted children globally are in South Asia, and over half of all wasted children are in South Asia, and this affects their growth and development in very significant ways. And then third, access to nutritious diets is still a challenge in several countries within the region. Too many infants are breastfed optimally. So early initiation rates of breastfeeding are still suboptimal. When we look at the regional average, 4 in 10 infants are actually put on breast milk within the first 1 hour of birth. And diets within the complementary feeding period also remain suboptimal. And 1 in 5 infants is fed a diverse range of nutritious foods. And of course, Sri Lanka stands out in the region as having higher rates of dietary diversity when it comes to young children. But still, some are missing out on the benefits of getting all the food groups, minimum of 5 food groups, which are needed for their healthy growth and development. And what's underlying this? At the heart of this are nutrition services not universally delivered across health system. It's a point which I'll touch on later on. We see a lot of opportunity gaps in the delivery of services. And secondly, we also see a lot of inequities in the delivery of those services. And food systems are also failing children because they are not delivering the nutritious foods which are needed for children. At the same time, we are seeing a big increase in availability of ultra-processed foods, which are contributing to the surge in overweight, obesity within countries in the region. And then lastly, social safety nets are not reaching the most vulnerable children where they exist, and often coverage is low, meaning those children in most need are not receiving these very important safety nets. I would also like to touch on a point which was highlighted by earlier speakers, that the climate change crisis, the global climate change crisis, is also increasing nutritional vulnerabilities and is threatening to slow or even reverse progress on nutrition in the region. Therefore, going forward, it's going to be important we ensure systems have a lot of resilience in the face of the global climate change crisis. And perhaps to further illustrate a point which I made, I think when it comes to girls and women, we think this is a very important pathway to address, especially if the region is going to accelerate its efforts in reducing malnutrition. Also important to break the intergenerational cycle of malnutrition, which is very much manifested in the high prevalence of low birth weight within the region. So the insults of malnutrition in utero is something which requires concerted efforts to reduce, both for the well-being and health of women, but more importantly, to break this intergenerational cycle of malnutrition that we see in the region. And it means we need to start the effort much earlier, improving the nutrition of adolescent girls, and secondly, ensuring adequate nutritional support and care during pre-conception, and also great support during the pregnancy period. As you can see, when looking across the different regions, the progress in reducing low birth weight has been very slow within South Asia. And compared to other regions, South Asia carries the highest burden compared to others. And we all know, why do we care about malnutrition, and why is it important? We know malnutrition causes an immense drain on human capital, posing a serious threat to the economic development of nations. And also for countries in the region, Sri Lanka included, ensuring good nutrition is very important to ensure the optimal development of young children, so that countries like Sri Lanka can be very competitive in the knowledge economy. And it's quite hard to be competitive in the knowledge economy if we continue having these high proportions of children who are stunted, who are wasted. And therefore, it's important we enhance the investments on nutrition to enhance also the competitiveness in the global knowledge economy, which is becoming critical now as we go forward, and also to drive the progress of countries. Most of you know that stunting, wasting, heat, and hunger, they threaten the cognitive development of children. On the left is sort of the typical brain cells of children who are not malnourished. But when they are malnourished, there's limited branching and there's impaired brain cell development. And this has huge implications later on the learning, mental development, and this adds a lot of cost to countries. So that's something which needs to be prevented, and we have the solutions, and we need to ensure all children access these solutions. So this loss of human capital, as I highlighted, it impacts a combination of skills, knowledge, and experiences that individuals accumulate throughout their lifetime. So it's beyond just a question of implications on disability adjusted life years, but also huge implications on educational attainment and also productivity as adults. And the evidence on this is very strong. And now I would like to sort of turn to the delivery challenge that we see in some of the countries in South Asia, which again speaks to the heart of this summit. How can we better deliver, primary healthcare services in resource-constrained settings? While we can always learn more, we know which interventions should be delivered to prevent and treat undernutrition. This starts in adolescence, in pre-pregnancy, during pregnancy, at birth, in the first 6 months of infants' lives, in the first 1 year, in the first 2 years. These are what's called the golden 1,000 days. They are very important because if we miss this window of opportunity, reversing malnutrition becomes difficult later on. Therefore, we need to ensure the whole range of high-impact nutrition interventions are being delivered within this continuum. Be it offering micronutrient supplements, appropriate counseling around nutritious, healthy dietary intake, but also providing, supporting caregivers and mothers and families on early exclusive breastfeeding, ensuring between 6 months and 2 years, infants and children have access to adequate complementary foods and continued breastfeeding, and also that early stimulation and care is supported to support with the child development. These are all important interventions that need to be delivered within this golden 1,000 day period. But the reality, not all infants and children are benefiting from these interventions which need to be delivered. And we start seeing big opportunity gaps in the delivery of services. For example, maternity services are not being leveraged enough to support initiation of breastfeeding within the first 1 hour. Sri Lanka is a positive exemplar in the sense that this support around breastfeeding is well integrated within your healthcare system. But in other countries, it's not the same. For example, in Pakistan, what we see is when it comes to skilled birth attendance, it is high level of coverage. But when it comes to early initiation of breastfeeding within 1 hour, less than 1 in 4 infants are actually put on breast milk within 1 hour. So for us, we see this as a huge opportunity gap which needs to be narrowed, especially when you have great coverage around your health delivery system. And the big question that we need to ask ourselves, why do we continue having these gaps? And I'm sure we can find solutions, especially for those countries where these gaps manifest. And then secondly, using an example from Nepal, we also see faltering in coverage of key nutrition interventions. So for example, consumption of iron folate, receipt of iron and consumption within the at least 90 days, good coverage, around almost 90%. But when it comes to full compliance, we start seeing faltering of that coverage. It drops down. And then the same when it comes to quality of antenatal care in some countries is still a challenge. So the minimum of 4 antenatal care contacts still high, but when it comes to 8 antenatal care contacts, we see faltering, which impacts provision of quality care or of services. So these are some of the gaps that we feel need to be narrowed within systems of delivery. And then now I would like to draw on some of the work that we've done in collaboration with some of our partners, the International Food Policy Research Institution. What we did, drawing on demographic health survey data sets, we tried to assess the reach of essential nutrition interventions. So looking at what proportion of mother-child pairs are receiving the full range of nutrition interventions. So for this analysis, we looked at 8 essential nutrition interventions, looking how many of the mother-child pairs within the same households were receiving these. So looking, majority of the mother-child pairs were receiving less than 4 out of 8 essential nutrition interventions. So which means there's a gap in the delivery which needs to be narrowed so that all mothers and children, is sort of one diet, we need to ensure they are receiving the full range of interventions. And then secondly, we also noted, I think I've given the example of antenatal care and consumption of iron supplements, that improving nutrition actions within the health system can help close opportunity gaps that exist. But also in some countries, the health delivery platform itself needs further strengthening to improve coverage, but also to ensure it achieves effective coverage, which comes with quality of care. And also what we see when we look at core coverage of health and nutrition interventions, we see high variability also across some of the countries in the region. So while the health core coverage is quite high, we don't see the same around the nutrition core coverage. So which means the systems are not fully delivering for the mother-child diet in terms of the full range of interventions. The same in India, looking at the DHS data, good core coverage of health interventions and also the delivery platform, good coverage, but we see variation when it comes to nutrition core coverage. And then of course, this variation varies geographically within the different countries, pointing to differences in delivery capacities which need to be addressed. And behind this, using the example of interventions delivered for pregnant women, what we see across the region for the different interventions, that they are the ones in the red colors, that across majority of countries we see some significant bottlenecks when it comes to delivery of some of the interventions, be it delivery of some micronutrient supplementation, and some of these bottlenecks across the different health system blocks when it comes either budgeting and financing or data and information challenges, which preclude seeing where are some of the gaps in delivery and taking corrective action. And these system bottlenecks, they need to be plugged to deliver proven interventions so that they can be delivered with high coverage. So now, perhaps to some of the ideas that I would like to share in terms of what needs to be done to accelerate progress in reducing malnutrition in the region, but also improving the delivery of key interventions. One, the high burden of malnutrition has immense consequences for children's ability to survive and develop, and significant implications for shared prosperity. Secondly, the geographic and population coverage of nutrition interventions in the region is currently not at the level needed to transform the care of children and women. And I think there's a lot we can learn from Sri Lanka, how the primary health care system, the community system, is able to deliver with high coverage, so that other countries can also narrow some of those gaps in coverage of interventions. More importantly, the opportunity gaps, which I highlighted, that in some cases, the delivery platforms have high coverage, but when it comes to essential nutrition interventions, we start seeing some of the gaps there. And large-scale programs that deliver interventions across the life cycle are very much needed within the 1,000 days, which I highlighted, with a special focus on improving the nutrition status of women before and during pregnancy, and also improving the diets of children less than 2 years, breastfeeding and complementary foods being a key part of that. And fourth, policy and program efforts should pay immediate attention to closing coverage, equity, and opportunity gaps, and ramping up nutrition delivery through the various delivery platforms. And a multi-system response is very much needed, given the drivers underlying malnutrition within the region. And robust nutrition coverage data is needed to enable progress tracking of nutrition intervention delivery around this continuum of care is very much needed in the region. And looking at the core coverage of nutrition interventions is very important. We know, as part of the Universal Health Coverage Index, there's already the core coverage tracking for health interventions, but we don't have one for nutrition. So that's something we encourage countries to also look into, tapping into existing data, survey data systems, to also analyze this and see where are some of the gaps, so that those can be filled. And then lastly, I think to improve and also ensure the most disadvantaged children and their families receive adequate services, we need to also be intentional as part of the scaling up efforts to also address some of the social and gender inequalities that slow progress on nutrition, especially amongst those disadvantaged children, girls, and women living in the most challenging circumstances, so that we enhance the demand for services. But we think community systems play a key role for that. So we need to ensure we leverage the community delivery platforms and ensure the full package of nutrition services is being delivered. So I think, maybe to sum up, I think in line with the theme of this summit, for us, I think South Asia region has made significant progress when it comes to reducing child mortality, but reducing malnutrition has not moved at the same pace. Therefore, we feel it's one of the key determinants of health that requires acceleration in the region. And we think the primary healthcare systems, the community systems, that are already there, we need to ensure they are delivering on these essential nutrition interventions. Thank you so much for your attention.
Thank you very much, Dr. Sibai Morira, for that thought-provoking and inspiring keynote address. So your insights into the critical challenges and opportunities in maternal and child nutrition have not only enlightened the audience, but also reignited our collective commitment to closing the equity gap in public health across South Asia. So we are truly grateful for your presence here today and for the valuable perspectives you have so generously shared with this forum. So as a gesture of our deep appreciation, may I now invite Dr. Morira to kindly step forward to the stage once again, while I also invite the conference chair of the Global Public Health Summit 2025 and the president of the College of the Committee Physicians of Sri Lanka, Dr. Kapila Jayarathne, to join us on stage and present a token of appreciation in honor of Dr. Morira's outstanding contribution to this summit. Thank you. And up next, we take a delightful pause from